Assessing peripheral pulse by palpation. Goal: the patient accurately assess without any injuries and the patient is experience a minimal discomfort. So the equipment, we have watch with the second hand, and then paper and pen or computerized record, and then we have a non-sterile glove and additional PPE here, and then procedure. Assessment: choose a site and then to assess the pulse. And then for an adult, most common site is the radial pulse. For the child older than 2 years old, you can use a radial pulse here. And then if the children younger than 2 years old, auscultate the apical site. And then after that is assess for the factors that could affect the characteristic of the patient, such as patient age, the fluid balance, the amount of exercise and medication, and note the baseline or the pulse measurement. And then for the implementation, check the nursing care plan for the frequency, and more frequency for the pulse could be more appropriate for the nursing judgment. And then after that is perform a hand hygiene to remove all the microorganisms. And then introduce yourself to your client and verify the client identity. So, hello po ma'am, good afternoon. I'm your nurse Arlene from Tarlac State University. May I know your name po? And then after that, explain to your client what you're going to do and why it is necessary and how the client can cooperate. So ma'am, we will going to get your pulse rate po. It's okay lang. It's okay po. And then, after that, provide a client privacy. Close the door and especially the curtain. And then, put a gloves. We have here a non-sterile gloves. And then after that, select a peripheral site that based on the assessment data. And then after that is move the client clothes and then choose the site. And then through the use of first, second, and third finger, place this over the artery. And then after that, using a watch, and we can get we can count the pulsation and multiply by the number 2. So we have here a cellular phone. Let's assume this is a watch. Ma'am, is it okay po to get your pulse? And then after that, multiply the pulse rate by number 2. So the the pulse rate is 50 times 2 equals to 100. So ma'am, your pulse rate is 100, and don't worry ma'am, it is normal. And then after that, note the rhythm and the amplitude. And then after that is when measured is completed, remove the non-sterile gloves. And then after that, perform a hand hygiene to remove all the microorganisms. And then after that, help the client to inappropriate position and incomfortable position. So, ayos ko kayo, ma'am. And then after that, for the evaluation, the client assess accurately and without any injury, and the clients experience a minimal discomfort. And then for the documentation, record the client pulse rate reading. So ma'am, your pulse rate is 100. It is normal po. And then wala po kayong dapat ipag-worry. And then after that is identify the client site, and then report the abnormal findings to the appropriate person. So this is the end of the assessing the peripheral pulse by palpation. Assessing respiration. So the goal here, the client is the respiration are assessed accurately, and the clients experience a minimal discomfort. So we have the equipment, so watch or digital readouts, and then pen or pencil or computerized record. And we have here a PPE. So the procedures, assessment, so the factors that could affect the respiration, such as the medication, smoking, chronic illness, or the condition. And note the baseline or the previous measurement of the respiration. So any signs respiration distress, which include restriction, the nasal flaring, and grunting. So for the implementation, so before anything else, perform a hand hygiene and wear a non-sterile gloves. So we have here alcohol to remove all the microorganisms. And then after that, while the fingers is in, so before anything else, ask the client if he or she ready. So ma'am, are you ready po? And then after that, let's proceed. So while the fingers is still in the place for the pulse measurement after the counting of the pulse. So observe the patient respiration. And then note the rise and fall of the patient chest. Using here a cellular phone, let's assume that this is a watch. Count within 30 seconds, and then multiply by 2 to get the respiration of the client. So, ma'am, your respiratory rate po is 8, and then multiply by 2, and then equals to 16. So, ma'am, your respiratory rate is normal. Wala po kayong dapat ika-worry. And then, after that is, if respiration abnormal, in any ways, count the respiration complete with 1 minute. And then after that, when measurement completed, remove the non-sterile gloves. And then after that, perform a hand hygiene. And then after that, cover the patient into the comfortable position. So, ma'am, I'll speak tayo, ma'am. And then after that, for the evaluation is the patient respiratory is accurately assessed and without any injuries, and the patient is experience a minimal discomfort. So, for the documentation is the document the respiratory rate and then the rhythm on a paper or in computerized record. So, ma'am, your respiratory rate is 16, and normal lang po ito. Wala po kayong dapat ikabahala. And then after that is repeat any abnormal findings or report the abnormal findings into the appropriate person. So this is the end of the assessing of the respiration of the client. Thank you po, ma'am.